program live from Maqala. Thank you very much for being with us. Here are today's news, and I'll proceed to the details. Tigray External Affairs Office issued a statement on Saturday saying despite a declaration of humanitarian truce on the side of Abiy Ahmed's government, 2 days ago, Tigray has not seen any improved access to humanitarian aid. The office said that Tigray would need access to 700 truckloads of humanitarian aid to address the humanitarian crisis on the ground, but has not received any amount of food aid since mid-December 2021. The statement issued also said that Ethiopian authorities were working in collaboration with Afar regional authorities that are working to obstruct aid coming to Tigray. The government of Tigray had issued a statement on Thursday sharing its interest for the cessation of hostilities in the event that people of Tigray are able to receive the level of humanitarian assistance needed within a reasonable time frame. The statement had also listed the restoration of telecommunication and banking services as among very few steps Abiy Ahmed's government could take to save countless lives in Tigray. The office also said that despite repeated false promises on the side of Abiy Ahmed's government, Tigray will continue to maintain faith that Ethiopian authorities will break with traditions and honor their promises. The deliberate destruction of health facilities and the blockade on essential items such as medical supplies has put millions in dire conditions. Our reporter visited Addishuhu Primary Hospital, where doctors explained the impact of the blockade of medical supplies upon their patients. The doctors say that patients, including babes, are dying due to lack of medication. For more, Saron Zagay.
Getting into Addishuhu Primary Hospital in southern Tigray, first thing you notice is the empty beds. Dr. Goitom Girmay, medical director, explains that the beds were previously occupied with patients getting medical care, but since there is no medicine, especially intravenous medication, there are no inpatients anymore.
We have no intravenous medication which would have been given through injection. Hence, beds are empty. Even the occupied ones have no fluids, bed sheets or anything, just mattresses.
Dr. Goitom and his colleagues explained the nightmare which has become their daily experience as medical personnel in Tigray. They say that the patients are dying in their hands, while they have the skill to treat them, but completely unable as there is no medical supplies to use. As a result, mothers dying while giving birth at home, and emergency patients are suffering from easily treatable cases for there is no oxygen to give them immediately.
Simple medications given at emergency center for emergency cases are non-existent. There is no oxygen and no electricity. Hence, patients, including babies, die on a daily basis.
Coordinator of the Maternal and Pediatric Unit, Mr. Abadi Ngusa, states that pregnant mothers are dying while giving birth due to lack of medical supplies. Most of the mothers don't even bother coming to the hospital because there is nothing more they can get than giving birth at their home.
Our biggest challenge is giving care to newborn babies, especially those who are under 28 days, because there is no medicine. Even some of them are delivered at home, then brought here after their health condition deteriorates.
Mr. Guush Fissaha, General Manager of the Primary Hospital, and Dr. Gabrakiros Tesfai, on their part explained that even if you figure out the complications from which the patients are suffering, getting the treatment is impossible. Patients suffering from chronic disease are also not getting any kind of care.
It's very distressing to say there is no medicine to a patient after he had figured out the complication in written prescription. Our patients understand the problem that we all are in, so they just thank you for your service and go home to die.
Patients suffering from chronic illnesses such as diabetes and blood pressure are in a terrible situation. There is no medication or treatment being provided. As a result, we are losing many patients.
On top of this, the health professionals haven't been paid their salary for more than 9 months, which is making their lives even tougher. The health professionals describe their situation as devastating and that they and their family members are starving.
We have no salary. We are suffering and starving.
As medical professionals here in general, we are under immense suffering and starvation.
The 8 months long occupation of Tigray has seen unspeakable horrors ranging from rape to indiscriminate killing of innocent civilians, including children. Many have left their hometowns in an attempt to escape from these atrocities. Our reporters spoke with IDPs from Western Tigray and explained about the horrors they underwent. For more, Fanny Rimru reports.
The devastating effect of the war in Tigray is more conspicuously observed in Western Tigray, where the Fano vigilante group and Amhara militias carried out an ethnic cleansing campaign in collaboration with the Eritrean forces. These allied forces have carried out numerous atrocities upon civilian residents of Western Tigray zone. IDPs from Western Tigray explained the situation as follows.
These invading forces started their aggression on November 4, 2020. After 3 days, on the 7th of November 2020, they burned a village called Division using lethal artillery weapons. They destroyed the whole village after the Amhara Special Forces and Fano looted our properties and our sesame crops.
They killed 20 to 30 civilians in our neighborhood. A guy called Tawalda Girmay and his whole family was massacred ruthlessly by these forces.
The IDPs also said that they are forced to beg for food as humanitarian aid is blocked due to the siege.
Even after reaching the IDP center, we are struggling to survive as there is no food. I am begging from the society as the aid they gave me is not sufficient to feed my family. They only gave me 15 kilograms of weight to feed my 6 family members.
I am here with my 3 brothers, but I couldn't able to feed them. We're only getting 15 kilos of food aid per family.
The IDPs called on the international community for help in ending the siege and save them from dying due to starvation.
There are children and elderly suffering from starvation-caused disease. People with chronic illness are suffering due to the siege. They couldn't get any medication as there is no medicine and food. I beg on the international community and humanitarian groups to save us before it is too late.
We want the siege to be ended immediately. The people of Tigray is in danger, so I call on the international community to act now.
The physical damage on public institutions across Tigray has resulted in immeasurable consequences across the state. The destruction of higher education institutions in Tigray has resulted in the complete closure of the education programs across the 4 universities based in Tigray. And the Tigrayan students who had been pursuing their study within Tigray and in other parts of Ethiopia have been denied their right to education for 2 academic years. For more, Wintakidana reports.
In addition to the systematic destruction of public institutions like school and health facilities in the rural area, Tigray has lost many highly developed institutions that has took decades to build. Higher education institutions are among the most targets of this deliberate attack. Universities in Tigray that are used to produce thousands of trained students for the country are destroyed and their materials looted by the invaders. For that reason, Tigrayan students unable to find any access to education elsewhere haven't been attending school for more than 2 years now.
Tigray ዝበሃል ዝተምሃረ ዓቅም ዘለዎ ዓዲ ክልውጥ ዝኽእል ምስ ካልኦት ዓለማት ክወዳደር ዝኽእል ትግራይ ክፍጠር ስለዘይተደለየ እዩ ክዓኑ ተገይሩ
They destroyed higher education institutions because they don't want to see educated, competitive, and full of potential Tigrayans who can develop their nation. Also, they want the students to be hopeless and unable to envision to change their lives and their society.
We are out of education for more than 2 years. Almost all universities and colleges in Tigray are destroyed.
Instructors from Maqala University say that students of Tigray are deliberately made to think only about war and its consequences in their young age, and the destruction of the higher education institutions in Tigray will take years to fix.
For 2 years, Tigray hasn't made any trained students, and this will create a gap in the economic, social, and political aspects of the society. It is impossible to fix thus all damages of the war within 2 years because the consequence of the destruction is intense.
When we think about the long-time effect of the destruction made by the past 2 years, the consequences may stay for the next 10 years.
The instructors added that the brutal murder of students everywhere in Tigray and the systematic destruction of schools show the vicious intentions of the invaders.
If you don't like the existence of a society, you don't want it to get civilized or build its capacity. So if you critically observe about the war and its consequences in the education sector, you will understand that they don't want us to exist. So I think that will sum up everything.
Above all, the destructions made in Tigray, the systematic destruction made to leave Tigrayan out of skilled population is the worst.
Dr. Tadesse Kahsai, an associate professor of education system at Mekelle University, says that the destruction of institutions that are centers for research and creativity is a long-time planned action to stop the institutions from training and generating skilled human power.
The main purpose of higher education institutions is to generate ideas. So, by destroying higher education institutions, they want to see Tigray with no ideas. Because if you don't have the idea, you cannot pursue or refine politics or develop democracy. Therefore, the termination of education means nothing but creating a generation that cannot generate ideas. The continued attack on the educational institutions, starting from kindergarten and elementary schools to higher education institutions, is to bring to a halt of a population that believes in reasoning or is capable of questioning.
It's been 9 months now since Tigray has been cut off from the rest of the world following the all-encompassing siege. Accordingly, all essential items including food and medical supplies have been depleted due to the fatal siege. Children, one of the most vulnerable parts of any society, have been largely affected by this unbearable situation. The Family Guidance Association of Ethiopia Northern Branch, located in Mekelle, has now run out of all vaccines for children, leaving them at risk of developing diseases like measles and polio, which are eliminated from the country through continuous vaccine campaigns. Abazash Baraki, a nurse at the Family Guidance Association of Ethiopia Northern Branch, says children are prone to infectious diseases that are leading to high rate of mortality and diseases. For more, Heidegger reports.
Tigray's health system was one of the best health systems in the country, essentially reducing maternal and infant mortality. Effective vaccination of newborns and children on time has a significant role to have a healthy generation for the future. Following the de facto blockade for over 9 months in Tigray, all essential items including food, medical supplies and humanitarian aid couldn't enter into the region. Consequently, health facilities are unable to provide life-saving services in the face of alarmingly growing demands. Abazash Baraki, a nurse at the Family Guidance Association of Ethiopia Northern Branch, says newborns and children are prone to infectious diseases that are leading to different diseases and high rate of mortality due to lack of vaccines.
Children could easily get sick unless they are vaccinated. They may also suffer from diarrhea. As a result, they can decrease their body weight. On top of this, newborns and children can also develop other infectious diseases. Currently, it's a common phenomenon to see children dying due to vaccine inaccessibility.
Gabra Haurea Gabra Christos, coordinator for vaccinating children and mothers at Tigray Health Bureau, says that children must be continuously vaccinated as of day 1 till a year and above. He also added that such vaccines can prevent them from being affected by 10 disease types.
All kinds of vaccines must be finished before certain months, step by step. However, they are spending their time unvaccinated following the destruction and looting of health facilities imposed on Tigray. Thus, Tigrayan children are being exposed to infectious disease like measles, cholera, and others.
According to WHO report, over 200,000 children in Tigray have gone without vaccine in the past year. This means the lives of newborns and children under 5 years are at risk, as they are prone to infectious diseases that are leading to a high rate of mortality and long-term disability like blindness, deafness, and the like. Gabrahaurea Gabra Christos also stated that vaccines have become inaccessible due to the deadly siege. According to him, the fact that the health facilities in Tigray have been looted and destroyed by the Ethiopian government forces and their allies has also severely affected the health service provision in the region.
Health facilities in Tigray have been deliberately destroyed by the invading forces. Either comprehensive specialized referral hospital was the only health institution which was providing better medical services for over 1 million people from Tigray including patients from the neighboring Afar and Amhara regions yearly. But now, the hospital could not give even vaccines due to lack of medical equipment and other supplies.
The health professionals called on the international community to reach the millions of Tigrayans in need of healthcare assistance.
We plead to the international community to understand our problems and help us with medical supplies, as thousands of Tigrayans are falling like leaves in autumn due to the siege. We also call on members of the Tigray diaspora to make our voices heard across the world. The World Health Organization must also discharge its responsibility by supplying medical equipment and essential supplies. We need access not only to vaccines, but also to all health packages the soonest possible.
The deliberate and systematic destruction of Tigray's public and private facilities is one of the features of the year-long war on Tigray. Tigray's Animal Health Service is one of the facilities that are destroyed and looted by the Ethiopian forces and their allies. The ongoing humanitarian catastrophe in Tigray is the result of the destruction of such facilities. The lives of millions is dependent on animals. For more, Aragawi Garumkel reports.
The lives of human beings and animals in Tigray are highly interconnected, as 80% of the population is dependent on agriculture and animal husbandry. The year-long war in Tigray has devastated the animal health service and created an extreme humanitarian catastrophe. Tigray's Bureau of Agriculture and Rural Development has conducted an assessment to investigate the impact of the war on animal health service in Tigray. Dr. Gabru Lagasa, coordinator of animal health at the Bureau, said that animal health was one of the development concerns of the government of Tigray, and a lot of manpower was used to participate in the sector.
We used to have 201 governmental health centers for animals throughout Tigray. Not only that, there were also 160 private sectors that have been participating as importers, wholesalers, and pharmaceuticals.
Dr. Gabru also said that 92% of animal health facilities were looted and 100% of them have become out of service.
Starting from October 2020 to June 2021, during the stay of the invading forces in Tigray, every facility in Tigray was targeted and consequently became dysfunctional. They literally turned them to tails. 83% of the facilities were destroyed, 92% of the facilities were also looted, and 100% of them have become out of service as there is no medicine and vaccination currently. The animals were also slaughtered, looted, and transported.
Around 15 trucks were used to transport the animals weekly from a market in Dansha to Nazareth, Hawassa, and elsewhere in Ethiopia. They used to transport a lot of cattle, sheep, and goats. If we ask the whereabouts of all that wealth now, what we get is nothing.
Veterinary participants from Mekelle University said that the population of Tigray has no meaningful life without animals, as its livelihood is already interconnected with its animal resources.
The life of the people of Tigray is directly interconnected with animals. There is no life without animals for the people of Tigray, as their economy and livelihood is dependent on animals. So, if once the animal wealth is destroyed, it is difficult to revive as a society.
The participants also said that talking about animal health means talking about the health and economy of a given population.
In the world, there are around 1,700 identified diseases of human beings, and 70% of these diseases have a direct relationship with animals. What does this mean? We can solve 70% of diseases of human beings while we work on health of animals. So when we talk about animal health, it means we are talking about human food and human health. Not only that, it also means we are talking about the economy of a household, a society, and a state.
According to the study of Tigray's Bureau of Agriculture and Rural Development, 108 centers of animal heredity were also destroyed by Ethiopian forces and their allies during the course of the war.
The systematic destruction of health facilities of Tigray and the 9-month-long siege that has depleted all essential medical supplies in the region has devastated Tigray's health system to the point that it's not able to care for even the most basic health complications. Our reporters visited the districts of Kulamakara and northeastern Tigray, where local officials say over 200 people have died due to lack of medication and essential medical supplies. Sarah Kalali reports.
The blockade on all medical supplies coming into Tigray has put at risk the lives of tens of thousands of patients suffering from chronic illnesses. Solomon and Yordanos Tesfai are residents of Gulamakhada, a district in northeastern Tigray. They both suffer from chronic illnesses but have remained dedicated to their work as civil servants.
I suffer from diabetes, high blood pressure, and a condition with my liver. I have no money and no one to help me. I am bedridden now.
In addition to pills for my high blood pressure, I have also been taking antiretroviral medication for 11 years now. There are no more medication now. We are all in a really bad condition. People here are bedridden. They can't get up from their beds. As if the lack of food wasn't enough, now our people are dying due to lack of medicine. There has to be some sort of solution, sometime this month. People are dying in droves. The situation here is very difficult to explain. The things I see here are very bad.
I have run out of medication. I have no money or medicine. I have dietary constraints, so I can't just eat or drink what available.
Coordinator for the Health Bureau in Gulamakhada, Arham Garamidhin, says that as a result of the systematic destruction of health facilities in the area and the ongoing siege, over 203 patients have lost their lives.
أفتي سلام جيزي لعل حموشة مئة زغنو حضور حمام زلهم سبعة نيرومنا.
Before the conflict, we have had 500 patients with chronic illnesses, and thus people cannot get any medicine. Because of the blockade, our district has run out of all medications for chronic illnesses. The patients have now started to die. In this district alone, 203 people have died due to lack of medicine.
The delivery of food aid and medication is essential and has to be resolved sooner than later.
As a human being, we have a right to medication and food. The world knows that and should do its best to bring out a solution.
The world has to help deliver food, medication, and fuel here. We are getting ill, we are suffering, and we are dying.
The systematic destruction of health facilities in Tigray, as well as a blockade on essential medical supplies, has resulted in what the Director General of the World Health Organization has referred to as the worst health crisis in the world.
Massacre, rape, and using hunger as a weapon of war have been the defining characteristics of the conflict in Tigray. 17 months into the deadly war, people across the region do witness the extrajudicial killings, gang rape, tortures carried out by Ethiopian forces and their allies. Maikenat, a town in the central zone of Tigray, is one of the towns that have suffered due to the genocidal war. For more, Kabram Waldabrhan reports.
In 2021, numerous civilians, including children, have been massacred in the district of Maikenat by Ethiopian and Eritrean forces. Taganat and Letabran's children, together with Fishai's 3 siblings and other 3 of his relatives, were taken from their respective houses by Eritrean troops. Then, they were shot and killed.
My son and I were running away into the wilderness. They found my son and killed him along with 3 other men on the 8th of February 2021. His body was left unburied. It was abandoned there for more than 3 days. Now it is in the mass grave, as we haven't been able to lay it to rest on its own burial place.
The soldiers said, "We want to save our bullets," and bombed 5 people, of whom were priests, a bride, and a bridegroom, as well as elders. The soldiers didn't allow us to bury the dead on time. Some of the bodies were eaten by dogs and scavengers.
3 of my siblings were killed by the Eritrean forces. They were only students. They had nothing to do with any militarized group. Their killing was unspeakably atrocious and satanic.
Debra Taglaimanat, administrator of the district of Maikenat, says that the Ethiopian forces and their allies from Eritrea have committed numerous allegations on civilian residents of the district.
They massacred countless civilians regardless of their age, sex, religion, and their identity. They burned down crops and houses of civilians. Many animals of the vicinities of our district were looted. Infrastructures were